One of the biggest misconceptions of brain surgery in the movies is what the neurosurgeon actually does. You'll often see a neurosurgeon do neurosurgery in the morning, and then he'll run off in the emergency room and then do plastic surgery in the afternoon. No, that doesn't work, okay? I mean, we do a lot of stuff, but we don't jump around between brain surgery, orthopedic surgery, neurosurgery, a little heart surgery. No, we don't do that. And the reason is because neurosurgery is so vast. There's so many different procedures to learn within neurosurgery that there's just no time to learn anything else, okay? Yes, I can do an appendectomy if forced to do it, and if I'm the last surgeon alive, but what I do really well is neurosurgery. There are about 50 or 60 procedures in neurosurgery that you have to learn and master, and each one of them has to be done over and over again, dozens of times to really get to a high mastery level. And so there's no way that you can do that. So in the movies, of course, you can't have a neurosurgeon do just one thing or two things. So that's why they mix it up to make it more interesting. Now, the other big misconception with neurosurgery is that it's particularly dangerous. And that misconception comes from the early history of neurosurgery, where the mortality rate was unacceptable, north of 50% mortality with each case. Part of that had to do with the lack of adequate anesthesia. Part of that had to do with the lack of adequate hemostasis, which is the capacity to control the blood loss. So now the mortality rate with neurosurgery is, for most procedures, far less than 1%. It's very rare for anybody to have that kind of a complication during surgery. In addition to that, the risks of something serious happening, like paralysis, is also pretty restricted. It's depending on where the lesion is. Most of the time, that complication can be avoided. So even then, it's far more safe. And third, with all we have now in terms of the postoperative care and the recovery, it really optimizes the recovery to such a degree that most patients are out of bed the day of surgery or that evening. They're being removed out of the ICU maybe in a day or two, and they can be discharged out of the hospital in 2 or 3 days. So that's the reality of neurosurgery. Everything else is either the distant past or Hollywood.